Okay. Hi, everyone. I'm Dr. Talene Keshishian. Some of you may know me from our LAC+USC podcast series from House Calls with Dr. K. Today, I'm honored to be moderating a town hall discussion about African American Heritage Month. We are looking forward to a great discussion, followed by a special episode of our podcast, which will be released tomorrow, in which our panelists will further share their personal experiences and thoughts. I would like to introduce Mr. Philip Moore, who will help moderate the discussion, and our panelists, Dr. Malvin Anders from Ophthalmology, Jackie Carter, registered nurse, Jamie Wells Robledo, registered nurse, and Kim Champagne, respiratory care. Thank you all of our panelists for being here today.
Thank you.
Thank you for having us.
Thank you.
Let's get the discussion started. I mean, we're all here for a very important reason. And just to provide some background information for our viewers, can we get some history about Black History Month and, where did it get its start?
Well, it's got started with Dr. Carter Woodson. He was a historian and author and editor. Grew up in Virginia, West Virginia, as a young boy. Parents were slaves, reportedly could not read or write, but he had a drive. When they moved to West Virginia, he was about 16 and was looking forward to going to high school, but had to work. But this man is so incredible that at age 20, he entered high school, at age 20. From there, in 2 years, he got his degree. He went on to travel. He got his bachelor's from, I want to say Kentucky, Brea, B-E-R-E-A, that's just me spelling, Brea, Kentucky, and then got his master's from University of Chicago and his PhD from Harvard. And he felt that the history was important, that we needed to know the history if we were going to have an intelligent conversation about our future. He, in 1929, approximately, after years of trying to get out there and educate people about Black history, he actually started, I think it was called Negro History Week in 1929, and that was the precursor to Black History Month. So that's kind of how we got to where we are.
And then I also understand that in the 60s, more consciousness became around Black history, and they turned it into a month. And it was celebrated in February because of the birthdays of Abraham Lincoln and Frederick Douglass in the month of February. And it became a month in 1976.
Thank you so much for that background information. And why do you think Black History Month is so important?
I think it's important because one of the things that I noticed in reading about Dr. Woodson is that at one point in his career, he realized that he was not moving forward in the usual channel of American history, and he basically bailed and started his movement to study African American history. So one of the reasons that happens is that basically the many contributions, not all, but many contributions of African Americans have basically been ignored. Either just not considered significant or just flat out ignored. So that's the reason.
Yeah,
also,
go ahead.
you have to know your history so you can build upon it also. And, so we can grow forward. So that's right. That's really important.
Yeah, it is important because, like Dr. Anderson was saying, some of the recognitions and the contributions that African Americans have provided to this country don't get recognized as much. I mean, there are certain things that we've done, but there's a lot more things, and it just makes the country and living in America much more richer, much more diversified when you recognize that the stoplight was developed by an African American man, and other kinds of milestones, especially those that come in the healthcare, where we are in this health setting. So I think it's very key and very important.
And Black history is American history.
Yes.
You cannot deny that we are essential to it and to the future of it. So you can't move forward in the future without learning from your past. And if it is not said aloud or represented properly in our American history, how will we know how to make sure that it is moved forward in all the things that we do here in America?
Dr. Woodson actually mentioned in a brief bit that I read that he hoped that one day it would not be necessary to have such a month.
Yes.
That hasn't happened yet.
Yes. We're still making progress.
Definitely.
Still making progress.
Yes.
For me?
Yeah.
Okay, next up, I'd like to know, can you explain the value added in having a diversified, multi-ethnic, and multicultural workforce here at LAC? Or from your experiences, if you were in other places before you came to LAC, what's the benefit? Kim, what do you say?
The benefit is because we now understand each other more, our cultures, a lot of behavior are from cultures, and we recognize that somebody might do something and it looks a little odd to us and say, oh, well, that's in their culture, and we explain that, and we have our diversity that we take yearly, courses that we take yearly, and those are really important. One thing stands out to me, a few years ago we had a big union party at the Bonaventure, and my husband says, wow, I've never seen so many people together, all these different cultures. I said, yeah, we work together, we eat together, and that was most impressive to me.
Right,
Yeah.
right. Very true. Jamie, how about you?
So I think it's so important to see a diversified workforce because we have problems, right? And we need multiple avenues of approaches, right? And everyone in different backgrounds or ethnicities are able to bring what they have to the table. We can't be colorblind to all the ethnicities out there, right? Because these cultures and ethnicities make us who we are, right? And how can we serve the people if we don't know who we are or contribute to how we can help them? So by having that diversity, we are even more prepared to serve more people and the broader population by having multiple people with their approaches, give into our workforce. But if we don't have that and negate it, we're not able to do that.
Very true, very. Now, Jamie, you have an interesting background. You have an African-American background and an Asian background. So you got the best of two worlds. How do you balance and understand both?
So I am biracial. My dad is Black. He is from Mississippi down south, and my mom is Filipino. She was born in the Philippines and came here when she was in college. So it's very interesting being biracial and navigating that. I remember my dad telling me when I was very, 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 very young. I think I was 4 or something, 3. They will always see you as Black first. Not as a woman, not as biracial, not as Filipino. They will see you as Black. That's just the reality of our world. And it has come to be very true. And I'm very aware of it, but at the same time, I make it part of who I am. Me and my sister talk about it. I am Black and I am Asian. I am both, but somehow I am neither. It's the weirdest thing to say, but it's been true as being biracial. And representation matters, in what we see in the workforce, seeing that it can come together just to serve a broader range of people. To understand both is to help both and to move forward with it all.
Yes, thanks. Jackie, your experience in a multicultural, multi-ethnic workplace?
This is where I wanted to be. This is where I wanted to be. I am a county girl. No, seriously, my parents worked here. My dad worked here.
Wow.
My
Wow.
mother worked here. I was born here.
Wow. Oh my goodness.
My older brother worked here. This was home.
This is your
I
home.
just felt like I needed to be here to help the people. And this was calling me. I got hired other places, and I'm like, no, I need to work at county. I feel like I can do good here. And the fact that we get so many different people, and they all want help. And getting past what they see, getting past the color, and just, you are here to help me. I think that's one of the biggest things we can do. We're getting past it. You can help me. I don't care who you are, you're helping me, and that's kind of the bottom line there. So that's really what I wanted to do.
Do you find that as a nurse, when you first started out, that when you were trying to deliver that health care, and maybe a patient quite didn't understand, or if I wanted to receive help from a person that doesn't look like me, and is that person going to treat me the same, or is that person going to treat me a little bit differently based on maybe what my forefathers may have done to that population?
You would run into some of both. It's like, I'll give you an example. I had one patient who had very interesting tattoos. Let's just call it that, very interesting tattoos. And every time, he was intubated and half the time sedated. And every time he'd see me as his nurse, his eyes would get wide. His eyes would get wide. And he'd have me day after day. And it's like, and I would talk to him like I would talk to anybody else. You're a human being. Got to know him, found out what music he liked, brought in music. By the time he left, we were able to have a conversation about his past and just the things he had planned for his future. I would like to think we, made a difference. The care is the same. Everybody, I always say this, everybody is a VIP. That is my philosophy. Everybody is a VIP. Everybody should be treated the same, and that's the best.
I'm curious, seeing how you have such a family legacy here, have you or your family members told you how the atmosphere, the culture has changed?
Definitely.
Maybe from when they were hired to now.
Yes.
You?
It was, when they were hired, my parents came from Alabama in the 60s. So it was definitely different.
Sure.
It was harder to get in and to stay. And just, they ran into barriers trying to move, I would say, up the ladder or just promotions. They definitely ran into barriers. My mother left, not because of a barrier, but because she felt it was too far away from her kids. And but my dad retired from here. But they definitely felt some barriers. Even when I was in, and this I know is not necessarily the question, but even when I was going into nursing school, my mom warned me, you might run into barriers. And she said, you really just need to be prepared. And applying for nursing school, I hit my first barrier. I did not think it would be that quick. Just applying, not in, applying. So that was an experience.
Thank you for sharing.
One of the things that actually Jackie alluded to that I think is important in dealing with patients as far as the multicultural aspects are concerned is we have an opportunity here to learn from each other. And something as simple as explaining the procedure to a patient is a lot easier and a lot more fruitful if you have a better idea how to communicate with that patient. What words you use, how you use it, having some awareness of what might offend them. I think that's extremely important. One experience that I can think of that sort of affected me and how I interacted with a specific patient has to do with where I practice. In addition to teaching here at County, I have a small private practice, and it's in a largely white area with it's a mixed community, but largely white. And occasionally when a new patient is scheduled and I walk in the room, I get this look. And I want to say that by and large, patients really don't care. Patients really want to know that you're competent and that you care about them as an individual. That's the primary thing. And I think most patients don't care beyond that. But some might not expect you to be in a certain environment. And a few patients have actually asked me, what are you? And at first I didn't know what they were asking. What they were really asking is, what is my ethnicity? And I got the distinct impression that they would have felt more comfortable if I was black appearing from some foreign country rather than just a black American. Right. And that was kind of hurtful to me.
You mentioned the look. With you being a provider, how would you compare the look that your patients see you now when they're scheduled, as opposed to that look when you first finished medical school? And the difference between that, it was a look, but I imagine, did you maybe get some comments in addition to that look, or was it only the look and a leave?
Well, it's difficult to say because I have to admit I didn't think about that much as a medical student. Okay. And one of the reasons I didn't want to think about it is my own sense of perhaps anger about having to think about it. I sort of mentioned that earlier. And what I mean by that, I went to medical school, or started medical school, at a time when universities in general were being encouraged for a variety of reasons to increase black students, the volume of black students. And there was the presumption, at least I had the impression, that there was the assumption among many individuals around that time that any student who showed up and happened to be black wasn't quite up to par with what the other students were. And that was in the back of my mind. I didn't let it slow me down. I just kept my head down and did the work, and I did well. But I was resentful that I had to think about that. In terms of how I'm approached now, well, the cat's sort of out of the bag. People know who I am and what I am, and at least I think for the most part I'm respected for the work that I do.
Good.
I understand that also because when I started, and then I was working with some of the nurses, and the patients, the moms, and because I work with children, they would look at me, and then so my goal was to, when I achieved, just speak Spanish. So when I come in there, and then I first try speaking English to them, and then when I speak Spanish, then they're so comfortable with me, and my goal was to make them comfortable with me, and then so we could carry on. So that's been my success.
So you essentially then integrated another culture, another language in your daily work to even help you take care of your
My
patients.
patients, make them feel comfortable.
It's like finding a common ground.
Yes.
Absolutely.
And meeting the patient at their level
Right.
with their language and culture.
It worked out really well.
Definitely.
It really helps you take care of patients if they understand you and you have some sense of understanding.
Right.
Absolutely.
Next question is, after the Civil Rights Act of 1964, did you notice an invisible ceiling or policies that were established that kind of hindered the advancement of minorities, or whatever kind of challenges that African Americans face in the workforce today? Because there's been some progress from 1964, but sometimes I think that when you're required to do certain things, then maybe some organizations, whether they be healthcare organizations, business organizations, nonprofits, they will do the minimal amount required as opposed to doing what's right and fair. What are you guys' experience with that? We'll go ahead and start with Dr. Anders, and then we'll work our way around.
Well, the short answer is yes. The longer answer has to do with the ambiguities or attempts at covering up, for lack of a better word, certain ceilings. Even within medicine, during the time that I was beginning to think about ophthalmology and other specialties, nothing was stated and nothing was overt, but I had this sense that there were certain specialties that black folks shouldn't go into. Ophthalmology happened to be one of them. Neurosurgery happens to be one of them. And again, I can't say that hindered me necessarily. Obviously, I got where I needed to go, but I saw it hinder some other folks, and I didn't think that was fair. It's something that I have been taught from a young boy to overcome simply by being the best you can be and hopefully outscoring everybody else.
Right. It's funny you say be the best that you can be, because even in my experience growing up, my parents kind of laid the same foundation. It's like, okay, as an African American young man, you have to be way better. You can't get 100. If there's a test, you better have 110. But I said, well, Mom, there are no 10 extra points. She says, boy, you better get 110 on that test. And so I think
Extra credit.
Yes, better. So I think the expectation among African Americans that we had to go over and beyond just to prove that we were appropriate and suitable and met the criteria to be in that nursing school, the medical school, business, administration, respiratory care programs. Whatever we needed to be in, it needed to be that you need to be 10 times better, which in some instances it's a little bit more stressful, and it makes it appear like, well, why do I have to be much more better? How come I just can't be me? Or how come I just can't do what's required to prove that I'm worthy of the job, the appointment, sitting on a particular committee, or whatever that case may be?
And the other side of that also, again, I don't want to sound overly resentful here, but the reality is that there are circumstances, not just with me, but I see it frequently, where someone who's of a different complexion, who might be mediocre in training, or I won't say mediocre, might be less accomplished in training, may have an advantage. And when you have that perception, right or wrong, when you have the perception that you have not been rewarded for what you've done compared to what someone else didn't do, that's hurtful.
We have the term implicit bias, right? Mm-hmm. That it's unintentional, you didn't mean it, but the fact is, it's there. Right. And these implicit biases are maintained and sustained, and unfortunately affect people who are Black or other minorities or with other gender orientations or different sexual orientations. Mm-hmm. These things really still exist. And because of implicit bias, we have been encouraged to do twice as good as everyone, be better than everyone, because you have to get past what they see or know and show even more than others. And that has always been told of me. You have to be twice as good. You have to be even better. And then on top of that, there's also just being a woman on top of that. You have to be able to be polite and kind and, say and be, do what you need to do, but not be angry.
Right. That's right.
Don't be angry. Or,
Keep your place as a woman,
so that, are we sustaining these implicit biases, or are we mentioning them so that we can move forward?
Yes.
And like we were saying with even in the workforce, microaggressions as well, right? That they are not meant, they are not, but they are there and they still keep us down. And they have to be mentioned because, again, they're micro. You get picked until you get picked away too much, right? Yes. But they have a strong effect on the workforce and your joy in the workforce and how you enjoy your work, right? We're here almost more than we are at home, and we have to enjoy where we work. But at the same time, there's invisible ceilings that can cause us to not prevail or not to succeed in this place. But at the same time, we have to be better so that we can move forward when other people are not encouraged the same thing, but may have better treatment.
Yes.
And it's seen and has been seen. And I was not born, I was born in the 80s. And for the civil rights movements to happen in the 60s, to see the effects of it now, and how it translates and moves forward and is still here and still fighting, is still very present, and there's still work to be done.
Yes.
Yeah, you do bring up a good point, implicit bias. I mean, thank God that DHS, they recognize that, and that new implicit bias training that they have to just recognize, hey, it may not be intentional, but it's still there. So let's everybody go through this training. Let's look at that and recognize it is what it is, so we can deal with it. Because I think that's some of the challenges, even after the Civil Rights Act. The Civil Rights Act didn't really address the glass ceiling thing that would happen. And so then it was just a little bit more subtle, very subliminal, very slight digs that could be just as damaging as a foot on the neck. And so I think progress is made, and we're making enough progress, and there's still more progress to come. But I think sometimes people look at the Civil Rights Act as, well, after 1964, it was supposed to stop. It was supposed to get addressed. And I think that was the start of the conversation and the start of changing the organization and changing the world. But I think it's almost you could go another 100 years and we would still have challenges, some progress, but still some challenges in terms of what happens with those issues that were addressed and raised that civil rights were supposed to correct. And I think also sometimes people kind of forget that Civil Rights Act of '64 was not just for African Americans. Because you saw Martin Luther King and other African Americans as the face of it, it covered all minorities, it covered women. But I think the most, when you ask somebody really quickly, well, who was the Civil Rights Act for? Oh, it was for the black people. No, it wasn't. It was for all the minorities and females. But you're right, the glass ceiling is still there. We recognize it, and we still need to make further progress.
Can I ask a question real quick? Thank you so much for sharing kind of your upbringing and your experiences. I wonder, what do you feel like you need to tell your own children?
That they can do anything that they want to do. We have resources. You can do anything that you want to do. That's it. You know, I never felt I couldn't do anything that I wanted to do. And I think that's what I kept going because I'm a supervisor, because I felt I could do what I wanted to do. I didn't feel any restrictions. I was looking at that last question we had, and I didn't feel like I had any barriers. There were little obstacles, but I went around them. And I feel that that's what we should tell our kids.
I think that's extremely important. One, in building self-esteem in kids,
Yes.
especially young women. I happen to have 2 daughters, and I won't digress too much, but I need to share just a bit here that sort of gets to that issue. I was always taught to do whatever I wanted. I've taught my children to do whatever they wanted. For a variety of reasons, we happened to grow up in a community where we were one of a few black folks. Same thing for my children. I didn't learn this until years later, but my daughter, when she was applying for college, she wrote in a college essay about an episode that occurred to her in elementary school. And it sort of took me away, or blew me back when I read this, but basically what she was saying, that she did not have any sense that she was any different from anybody else in her school classes until she had to take some standardized tests as I think a first grader. And the teacher told all the students to check a certain box, and they told Rainey to check another box. And that's the first time she was aware that she was any different than anybody else. It didn't hinder her. She did what she needed to do. She grew up well and progressed, but it's just the idea that we have to instill in young folks, you can do whatever you want, is extremely important, and you are no better, no worse than anybody else.
Also, just letting them know that you're going to be there for them, no matter what.
Yes.
Be there for them no matter what. When I was 9, I had an altercation with another student. And we both got sent to the principal's office. Okay.
Uh-oh.
I've never been to the principal's office in my life. I was a straight A student who was working on her perfect attendance. So going to the principal's office was not part of my perfect attendance world. So I get there, and the other girl goes in and out, and I don't think anything about it. He calls me in, and he tells me he's going to call the police on me.
Whoa!
And I'm looking at him, and I'm, police. And I'm like, call my mom. And that's all I could say. I was just over. He goes, I'm calling the police on you. I said, you call my mom first. You call my mom first. I go nowhere without my mom. You call my mom first. And the way my parents had it is my dad worked days, my mom worked evenings, so there was always a parent home. So he called my mom. My mom came up, and my mom came in to the office and asked him what happened. I said, well, they got in an altercation. And he said he's calling the police on me. And he goes, I'm thinking about suspending her. My mother looked around and said, where's the other girl? And he goes, I sent her back to class. And my mother goes, excuse me? You sent her back to class? And you have my daughter in here and you're threatening her with the police? Have you lost your ever-loving mind? And my mother let him know, and very distinct non-curse words, what she thought of that, and that it would never happen if he was not to speak to me ever again. And that she offered me the option of going back to class or going to McDonald's. Okay, well, but still, without it affecting my attendance. But the fact, I did not recognize the whole situation until my mom got home, and my mom started explaining things to me. It's like, sweetheart, the person that you got an altercation with, what happened? Why was he threatening to call the police on you? I'm like, I don't understand it. And so it came up. Race came up in that conversation.
Of course.
And it was like, oh, okay. And that was my first indication that people are treated different.
Yeah.
She reflected the same race that the principal was. And she went back to class. So it was like, oh, okay. And so I did not have to speak to him again for a month. I was student of the month next week.
You sure showed him.
Yes. But the fact that you have to go through all of that is just...
That's the thing.
the fact
So
that
I'm
you
sure,
go through all of
Jackie,
that.
did that, from that point, well, first, the more important issue, did you get your attendance?
Yes, darling, I did.
Excellent.
Yes.
But would you say from that point forward, did that have an impact in terms of if you had a disagreement with another student, whether it be high school, junior high school, college, whatever, or on the workforce or any place else, would you say that that experience that you had at 9 flavored or countered how you would then handle disagreements or differences from that point forward? Recognizing that they will probably or may see my color first before they understand what's the disagreement that I have with this person and the value of, okay, am I the instigator or am I defending myself? What do you say to that?
I would say it definitely made me stop and think. It may not have stopped if I felt like something was wrong. It's not going to stop me. I'd stop and think, where is this going to go? But if I felt like it still needed to be pursued, then it's going to be pursued. And I'm one of those people that, well, I'll have to deal with the consequences or whatever they are, and then we're going to have to flush it all out. Is it appropriate? Is it not appropriate? Is it fair and equal? Is it fair and equal?
Yeah, Jackie's right. You can't let it go, though. You got to point out to folks that this is not the way to do things.
I have a young son. He's 4. And with the happenings in America right now, I wonder about the conversations I'm going to have when he gets older, right? And that's including with law enforcement and in healthcare and moving forward and what I have to describe and when I have to describe it and how do I engage that conversation at all, right? But yes, we can do everything. Like, let's talk about, we have our first Black, Asian vice president in our
Yes.
right?
Yes.
And we look at that and we see that representation and we're like, if she can get there, we can get there, right? Or even just looking at Obama as well, right? That we can get there. That the percentage is very low, right? Like 2% of African American females are lawyers, right? Like that's a very, very small percentage of lawyers, right? But can you do it? Yes. Will there probably be more coming up because of the representation? Yes. Because you can see how you can get there, that there's a paved way for you now. As before, there was no paved way. You just saw other people and that's for them, that's not for us, right? But now that you can see those channels, see the ways, and there's people to help you and there's people to move you forward and to get you there, and there's avenues where these systems are making sure that equality is embedded in their system as opposed to racism being embedded into the system. It will be very a way for us and a way for our children to see that we can do what we want. We could do and be who we want to be.
Yes.
And a lot of times now we know people that can aid us with our desired profession. You know, like I could say, well, I know so-and-so that is already doing that. You don't want to talk to this person or whatever. So we have, like, you know, have
Role
those
models,
mentors and role models now, because
Well,
these
we
people,
didn't have maybe 70, 80, 100 years
we
ago.
did not have them. Yes.
Very true. Dr. Anderson?
Yeah, I was just going to make the point, you made me think about something. There's a difference between legislated fairness and real fairness. And the legislation has to be in place for obvious reasons, but it doesn't address the issue of real fairness and the fact that we have mentors and people to help young folks get pointed in the right direction and not give up. That's the one thing that I'm fearful about. If you get beat down enough to being told you can't do it, depending on who you are, that might cause you to quit.
Sure.
Yes.
And that's where this issue of real fairness is important, I think.
One last question before we go on to Dr. T. Your comment about how would you then, since your son is 4 or 5 now, what do you think, because I've heard, and I think we've all heard those stories, these stories and experience that my parents had are not the same as mine. And the struggles that they went through with their businesses and their life is not quite the same. Mine is a little bit different. I get the same challenges, but they're just in a different way. They're not as blatant or as overt. How then do you think you would transition? Because I imagine for your son, by the time he sees that, okay, President Obama was an African-American, mixed-race person, and he was a president, 20 years from now, there may be much more progress. And so when mom and dad say, well, you know, for your ability to go to this school or to do this, there was a struggle and somebody paid the price for that. Do you get a sense of sometimes a little bit of complacency that you would think, or even from my parents' perspective, they may think that I'm a little bit complacent because the way that I handle things, and when they say, well, do you know, 40 years ago, you know, I couldn't do that, or that wasn't available to us, and now you just take it for granted. Do you sense that with that new generation coming forward, that there may be that bit of a gap? And
It's super interesting, right? Because we talk about civil rights and we act like it's so long ago. That was my father growing up. You know what I mean? So things pass on from generation to generation. The one conversation I could always remember with my dad, I was in band, you know, and I played the flute, just side stories. And I wanted to be cool in the band, and that was sitting in the back of the bus, okay? And so my dad would literally say, Jamie, and my sister also, don't sit in the back of the bus. I said, why? We fought so that we could sit wherever we want on the bus, right, Papa? I was like, right, Papa? And so my dad would forever tell me that. And I think I realized, unfortunately, that some people want to see you still sitting in the back of the bus.
Yeah.
And when I did, unfortunately, you know, came to that conclusion, I was like, oh man. But
how long did it take you to come to that? Was
Oh,
it immediate,
man.
or was it a couple of years later?
A couple of years later, no. I feel like even now is when it's really coming to light. A lot of things are coming to light. And I think it plays off another question, but at the same time, it's generational, right? And what they have learned and what they pass on to us, right? So what I'm going to tell my son is you should be able to sit where you like, anywhere. If they don't have a table for you, let's make a table. Pull up a chair, right? Do what you need to do so that you can be. But it's going to still resonate the stories that my dad has shared with me, where he was expected to sit in the back of the bus. Not asked, demanded, and that if you don't, you will be removed and not be able to go where you want. So it does transcend, right? We can sit where we want now, but the story will be different, right? Mommy got to sit wherever she wanted, but was still encouraged not to. You are now encouraged to do whatever. Make the bus if you want, like, you know? So it's just generational pass on. And it's not that long ago.
No, it's
the
not.
pictures are in black and white, but they could probably be in color,
Right.
right?
Very true.
Well, we keep talking about intergenerational trauma, right? That's what we keep talking about, and it leads to a mistrust that kind of gets passed down. What do you think about the mistrust in the African American community regarding medicine, especially now that we're talking about COVID-19, the vaccine? What are your thoughts?
Well, it's clearly something that we need to deal with, no question about that. I think one way you deal with it is by the example, and being the first to get the vaccine when you can get it. Also education and letting people know that scientists, happen to be a black scientist, helped develop the vaccine. That kind of information is important. And I think it's just a matter of, I think the biggest thing is education, letting people understand.
On top of that, I did hear some comments about the vaccine. It's, if you're not taking the vaccine, it's not smart, it's not right, it's not this. But that would be to negate experiences of black people in America.
Exactly.
We have seen, and everyone has heard of, the Tuskegee Study. This has been brought up so much more right now.
Yes.
And what happened in the Tuskegee Study. And we think that that's the main thing. It's only Tuskegee Study. No. As we mentioned, there's implicit bias. There is microaggressions. There are things that still exist and still prevail in our current society that contribute to the mistrust in healthcare.
That's along with the previous administration, the mistrust, because of that really played a big part in this mistrust also.
Right.
But
I think politics played a lot recently.
Yeah,
it really does.
Yeah.
so it continues not only from the Tuskegee Study, but moving forward. Because as we said, in generational, if your dad wasn't too keen on going to the doctor, are they going to be encouraging you to go to the doctor? Black women are often forced into healthcare when having children, but black men are not necessarily done so, correct?
Yes.
So we see this in the translation of the vaccine. When the vaccine is readily available, I don't trust you for a number of other things for the government.
Trust you now.
How am I going to trust you now with healthcare, right? But like Dr. Anders said, to know the knowledge that someone black contributed to the vaccine, that black people were in the study for the vaccine, that there are black people continuously receiving the vaccine. This is the type of information we have to know. And then I think that also echoes in us being healthcare providers, correct?
Right.
Being the representation that we trust
Exactly.
the healthcare system.
And then taking it back to our communities, taking it back to our churches, taking it back.
Yes.
And if they have questions, answering the questions or getting them the answers to the questions. And some of them may or may not still get the vaccine, but then just making sure that they do everything else that they need to do to try to stay healthy. But give you an example, my pastor was calling our mothers of the church and asking them, we're getting close coming back to church because we've been very good about the social distancing and everything. What do you think? And he said he was blown away. Most of the mothers said, yeah, I've already got my first dose. I'm working on my second. I'm waiting for my second and I'm good. And he was like, whoa, that's what I want to hear. Because he thought that might be a block for them to come back, but they were getting their doses and they were moving through.
But it took some didn't mean to cut you off, Jackie, but it did take some progress because in the beginning, there was a lot of reluctance. And like Jamie brought up and Dr. Anders brought up, there was a lot of reluctance in terms of I don't understand. I didn't know when African Americans were involved in the research and development of the vaccine. I didn't know that. So then as that started to become public, then it became a little bit more acceptable, okay, I don't think anybody would intentionally harm us now if you've had multicultural involvement in the development of it. And then also like you, Jackie, everybody in my neighborhood knows that I work for the health department. And as they would come and ask questions in terms of like, well, is it real and is it fake? And it's education, education, education. And I would just relish in I'm like, you guys call me, come knock on my door, ask any type of questions, because this is serious. It's not a hoax. It's not a joke. It's not misinformation that you may be getting from multiple outlets. We need to get this addressed, and we need to get it taken care of immediately. And it's not something to play with when you have a disease out there like that, especially a pandemic that would wipe out, that has already wiped out so many people, and so many people of color, and so many women, and so many people with comorbidities are just gone, and the grieving process hasn't even resolved. I mean, it's like somebody's passed, and it's like, well, you can't go to the funeral. Are we going to do a funeral on Zoom? Zoom what? You mean we don't get to go, especially in the African American community? That's a big event for African Americans. We bring all the family, we bring our culture, we bring all of our foods. Everything is taken together. We support and love the family, offer all kinds of condolences. And so even for us, and I imagine that will happen with other communities, we're going to be a little bit delayed in terms of the emotional progression. We've got the health progression, but the emotional progression that this pandemic has caused, whether it's your kids that are in school, the health care, the delayed health care, all that's going to be an impact. And so the country now needs to get with mental health and get those providers out there. It's been hard and it's been a challenge, but we do need the education, and I think that education does make it a little bit better for our minorities to accept the vaccine, accept the progress, to then review the science behind it, and not that this is just something hokey pokey that we want to do. So we're making progress.
Speaking about the pandemic, it's not only a physical pandemic, but a psychological one. And I'm a psychiatrist, as you all know, and I work in mental health, and this is kind of what I do all day long. What do you think about mental health and the appropriateness, or maybe the willingness to reach out for mental health services, well-being, taking care of one's psychological health in the African American community?
Extremely important. I think that that's another area of medicine that I think that African Americans may not have dialed into as
Yes.
well as other
Yes,
other
definitely.
cultures. And one thing that I thought of when Philip was speaking, the psychological effects on patients is one thing, and it's awful, no question. Psychological effect on doctors is not to be ignored either.
Absolutely.
I'm not in taking care of sick COVID patients, but I feel for the doctors who are.
Yes.
And I can tell you just from my experience of having to come to the hospital every day, just wondering about my own safety, and knowing that people are sick on the other side of that door, it must be awful for the doctors who are taking care of those patients. It's got to be a huge burden, and that cannot be ignored. We need care as well.
Absolutely.
It is important that you bring that up, because especially long time ago, African Americans didn't have access to health care nor mental health. And so when you've been disenfranchised for so long, we're just now recognizing that, like, okay, getting some mental health is good. That's not a bad thing, but that's taken 100 years to come to that conclusion. When we've been denied health care and mental health, then there is a reluctance to say, you know what? We've got some emotional issues going on here. There's help out there. We've had to internalize, we've had to turn to our faith, which has been our mental health provider for thousands of years. We've had to rely on that. So then when we have to then rely on another avenue that's out there that we didn't access, then yeah, it does raise the questions like, okay, why is there reluctance for African Americans to engage in mental health and behavioral services when they're much needed? It's just that background, and we'll eventually get there, because just like they're getting there with the health aspect, but I think Dr. Anders is right, and so are you, that the mental health and the emotional aspect is a little bit lagging behind the health access and health engagement with the African American population.
Also, we were taught to be strong, look strong, don't show weakness, right? And when you seek mental health help, that can be seen as a weakness. But now we are learning that to find help is not the weakness. That is a underlying strength to help you move forward. And once we understand that it's not the weakness, it is not stigmatized, it should not be stigmatized that you need mental health help, that it could actually help way more than it can hurt. That is what helps us. But if we continue that conversation of you're not being strong, you're looking weak, you're looking this, and you're not meeting whatever expectation of a strong Black woman or strong Black man is put out to be, we have to see that getting help is being a strong person, being a strong Black person, or being, just mentally there for yourself, your patients, your family.
Yes.
And once we understand that, and that we can help more people by being mentally well and taking care of ourselves.
There's the issue, taking care of ourselves. There's the issue.
Yes.
As nurses, I can't speak for anything, but as nurses,
Yes.
we go.
Yep.
And then we drop.
Yes.
And then we drop. So knowing that I'm exhausted at times, knowing that I need to get more sleep, that I need to eat better. And there are days I do, and there are days I don't. I'm just being real. There are days.
I'm sorry, who's here on her day off?
Yes, but planning it to be a short day.
Dedication.
Yes. But learning to take care of this. I am all about self-care. My mom was not. She was one of those that would go. But she taught me self-care, which I thought was amazing. Oh no, Jackie, you need to get out. You need to do this. You need to do that. Yes, go have your massages. Go do this. Go do that. So I really embraced that, and I just encourage others to breathe.
A shameless plug here for LAC+USC is helping healers heal.
Yes.
I think is one of the best things that I have seen here and known here. And H3, if people don't know what it is, I am blown away by that. I love it. I love it so much. And every time I hear we need H3 in this area because it's something that happened, I'm like, yes, please, right? And it's even as simple as they had an issue. Someone was rude and mean and ruined the dynamic of the unit. Let's have an H3 with them. And it's become so norm now that literally when there's issues in an area, I've heard it. Have you done an H3?
I know.
It is an expectation.
Yes.
It is not a if and or but. Who do you call? No. Get H3 here. And let's talk it
Helping
out.
healers heal. If you
Yes.
don't know, please check
And
out H3.
I think it's amazing because it lets us know that we need some healing sometimes.
It also says we matter.
Yes.
It also
Yes,
says
Jackie.
we matter.
Yes. And I remember taking the class to be one of the people that help healers heal, which is great. And I shared a story that I didn't even realize I needed to share. And I remember saying it, and we're taught to listen, exactly like you're doing right now, as everyone's doing right now, to not respond, not talk, not, let them talk. And when that happened, I was like, oh, I got it out. And it needed to get out, and it hadn't been out. It happened in the beginning of my nursing career. And to get it out then, which was a year ago, was so good to do. And so when I felt that, that's when I was like, oh man, there's something to this, right? There's something to this. And it's an expectation now. Like, get the help so that you can help. Because how are you supposed to help if you can, right? If you can't help yourself. So being knowledgeable of that is so important. And whatever you do to make that everywhere needs to be, because like Dr. Anders was saying, the providers here, we are going through a lot. And I think all of us have been in county for a long time. Everyone's like, oh, county, right? Everyone's heard that statement. And we go through a lot. And the patients we see, the employees we work with, everything is a lot sometimes, especially in this pandemic. So it's a great place to start, right? And then even going further, and if you need more mental health or a therapist or someone to talk to, that's a great starting point.
Yeah.
And it's
Yeah.
so great to see.
Yes.
Yes, thank you for bringing that up. Just for all the viewers, the resources are out there. The Schwartz rounds are excellent. Please join in, share. H3, Helping Healers Heal. The Care for County Caregivers. Make sure that you call in if you need extra support. This is really a time of togetherness and
Yes.
helping one another. And I love the high note that we're on. As we wrap up, can I ask one last question here?
Sure.
And the question is there a specific African American individual from the past or present who inspires you?
For me, that is Dr. LaSalle LaFall. I don't know, some of you probably know Dr. LaFall. He was a pioneer cancer surgeon. He was the first black or African American to be the president of the American Cancer Society. Also the first black president of the fellow American College of Surgeons. I was fortunate enough to have some interactions with Dr. LaFall as a student years ago. He's passed away now, obviously. For a short time in my education, I thought I wanted to be a dentist. And Dr. LaFall happened to be in the medical school right across from the dental school, and he taught our head and neck surgery, our head and neck anatomy. So I had some lectures from Dr. LaFall. I was extremely impressed by him at the time, but I didn't know who he really was at the time. Now that I know, he is my hero.
Wow.
For
Jackie,
me,
yeah.
it would be actually my mom and my aunts. They were all nurses. I've got cousins that are nurses. There's a lot of nurses in my family. So, and they just instilled in us, you get out there, you do your best, and you treat people with the best care you could possibly give. And while I'm on that note, can I give a shout out
Yeah.
just to some of the first nurse leaders here at LAC+USC? So do you know that Adele Magruder was the first African American nurse to graduate from the county nursing school? That was 1922. But going more current, I won't make you go through all the history, but going more current, I just want to give shout outs to the first surgical services clinical nursing director, Corrine Fields. Medical services, it was Betty Mosley. Psychiatric services, it was Sarah McKinney. Perioperative services, way to go, Miss Decatur.
Yes, Miss
Miss
Decatur.
Decatur. She is one of my idols. And then for emergency medicine, it was Gail Liggins. And Velda just recently retired. Velda Carter just recently retired. So, all the people that went before us that made it possible for us to be here
Yes.
and just, again, paved the way.
Definitely. For me, I'd say it's my dad. My dad was born in late 40s, grew up in the South in the 50s and 60s. He fought in the Army in Vietnam, and then he was hired as a firefighter in the 70s, which all of that sounds so hard, right? And somehow he made it through and has me, my sister, and my brother. And now he teaches us to do more, to spread more. My sister is a educator, my brother's an educator, and I'm a nurse. And I want to be a nurse educator on top of that. But we are a product of him and my mom's experiences moving forward to make a bigger impact, not only that he made on us, but for a broader population, to educate about the things that are so important to us, right? So for that, I commend him for what he has gone through and what he has raised in me and my sister and my brother, and wow, just a lot that he went through. So he always inspires me forever to do more, to do and be better, and to continue.
Well, for me, it's respiratory therapist. His name was Mr. Jackson. And so when we were in class and just starting, he says, he saw I had an interest. He says, now I'm going to teach you. I'm going to teach you like you are already graduated. He says, but one thing, you have to pass this on. I'm not going to teach you unless you teach others like that. So throughout my 25 years of being a supervisor here, I have taught my staff, the students, myself personally, and I take it and then I tell them that I need them to pass this on. And he was my mentor. Mm-hmm.
For me, it was my parents. I mean, I read history books of all the other African American accomplishments that came before me. And every now and then when I was a kid, I was just like, I don't see my mom or dad in here. I'm like, my mom and dad did miracle things for us and my family. And so just because they're not on a billboard, they don't have a street named after them, they don't have a building named after them, to me it's like it starts with them. And so they shape and develop the person that me and my brothers and sisters are. And so they're just my rock star idols, everything. We love them dearly, and it's like we wouldn't exist without you. And my personality, I mean, just the progress that I've made, what I've accomplished, I trace back to them. So it's very important for me.
Thank you all for sharing, and thank you to all the superstars who got us here today.
Definitely.
Yes, yes.
And I want to thank you all for being part of this panel. Thank you for opening up your hearts and sharing with everybody your thoughts, your feelings. I want to thank the viewers for joining us today. Please let us know how our town hall impacted you. And if we really want to celebrate diversity. If you would like to have more of these panels, different cultures, ethnicities, please let us know. We would love to continue the discussion. And please tune into the podcast that's going to be released the next day, that we are going to continue a more in-depth personal discussion with our panelists. So if you think we got deep today, wait until you tune in tomorrow. And thank you. Have a great day.